COVID-19 cases, it's causing the state to run short on ICU beds.
The governor said at one point today there were no open ICU beds available for COVID patients. Health officials say COVID patients make up about half of the state's ICU beds. A couple of weeks ago, the governor and Department of Health said they were making plans to create more COVID ICU bed space. He says they put most of those plans into motion, but now the situation has changed yet again.
And we did that at a time that we were not full, but we could see the increase, and we wanted to make sure we had a margin. There has been planning, and there has been those steps taken, and thank goodness we took those steps.
Health officials say the start of school and the upcoming Labor Day weekend could be the ultimate test of our healthcare system. Meanwhile, Baptist Health continues the long fight against COVID-19, adding more ICU beds at 2 campuses in the state.
Jessica Rank joining us now live outside of Baptist Health. Jessica, what's the hospital's plan moving forward, and will these extra beds be open anytime soon?
Yeah, Bob. Well, Baptist Health says they plan on adding 18 new ICU beds to both campuses, 10 in North Little Rock and the rest in Fort Smith. Now, they said they have all the equipment for the beds, and now it's just finding the nurses to staff them. As each day passes, more filter in through the doors of Baptist Health, but fewer are being discharged.
It is an urgent time.
Major hospitals across Arkansas are now scrambling to try and get more beds as COVID-19 hospitalizations rise.
I don't know of any more dire time in the state and the need for critical care in my 27 years than right now.
Tuesday, Baptist Health answering the call. They will be adding 18 ICU beds in the coming days in North Little Rock and Fort Smith. Of those, 15 will be dedicated solely to care for those with COVID-19. And the extra beds come at a crucial time. The state reporting at one point Tuesday, there were no COVID ICU beds available.
There has been planning, and there has been those steps taken, and thank goodness we took those steps.
But before they can put patients in beds,
none of us want to be in a hospital bed where there's nobody there.
They have to get the right number of staff. Greg Crane with Baptist Health says they'll be calling nurses from outside the state to lend a hand.
Those 18 beds are dependent on that staff showing up.
Crane says the solution is temporary.
There will become an end where there won't be any more what's next.
And the real fix will come when more decide to sit down and roll up their sleeves. Now, Baptist Health says they're pretty confident that they can get those doctors and nurses here in the coming days and on time. Now, of course, the additional ICU beds just come after that this hospital added 150 non-ICU beds for COVID patients. Live outside of Baptist Health, I'm Jessica Rank for KARK.